India is taking a proactive step in safeguarding public health by focusing on human metapneumovirus, HMPV. The recent surge in HMPV cases, particularly in Karnataka, has prompted the nation to establish standardized testing protocols. By prioritizing early and accurate diagnosis, the country aims to effectively manage the virus and prevent its widespread impact. The Indian government has recognized the need for a unified and reliable approach to HMPV testing. To address this, the Central Drug Standard Control Organization, CDSCO, and the Indian Council of Medical Research, ICMR, are joining forces. Their goal is to develop and implement comprehensive quality protocols for HMPV testing kits. These protocols are designed to ensure that all tests conducted meet stringent standards of accuracy and reliability. By establishing a standardized system, healthcare providers across the country will have access to high-quality diagnostic tools. This will enable them to confidently identify HMPV infections and provide timely and appropriate care to patients. The move is also expected to streamline data collection, allowing health authorities to monitor the virus's spread more effectively. This coordinated effort reflects India's dedication to strengthening its healthcare system and ensuring the well-being of its citizens. By investing in robust testing infrastructure, India is also paving the way for future research and development. Human Metapneumovirus, commonly known as HMPV, is a respiratory virus that often goes unnoticed but has the potential to cause severe respiratory illnesses. This virus spreads through respiratory droplets, similar to the common cold or flu, often through coughing or sneezing. The symptoms of HMPV often mimic those of other common respiratory infections, making it difficult to diagnose based on symptoms alone. Individuals infected with HMPV may experience a runny nose, cough, sore throat, and fever. In some cases, the infection can lead to more serious conditions like bronchitis and pneumonia, particularly in young children, older adults, and individuals with weakened immune systems. Recognizing the potential severity of HMPV, particularly in vulnerable groups, makes it crucial to understand the virus's behavior and develop effective strategies for its control. Therefore, raising awareness about HMPV, its symptoms, and modes of transmission is crucial in curbing its spread. Early and accurate diagnosis is key to containing the spread of the virus and preventing severe outcomes. In the realm of infectious diseases, accurate and timely diagnosis is paramount. This is particularly true for HMPV, a virus that can easily masquerade as other common respiratory illnesses. The lack of specific symptoms makes clinical diagnosis challenging, highlighting the critical need for reliable laboratory testing. The accuracy of HMPV testing is not just about identifying the virus, it's about providing appropriate care, preventing unnecessary antibiotic use, and implementing effective public health measures. The move by India to standardize HMPV testing protocols is a significant step towards ensuring that the diagnostic tools used are both accurate and reliable. This will minimize the chances of misdiagnosis, ensuring that patients receive the right treatment at the right time. Beyond individual patient care, standardized testing is crucial for effective public health surveillance. Reliable data on HMPV prevalence is essential for monitoring disease trends, identifying outbreaks, and implementing timely interventions. With standardized protocols in place, health authorities can collect and analyze data from different regions using a uniform approach. By working together, these stakeholders can ensure that accurate and reliable HMPV testing is accessible to all who need it, contributing to a healthier and safer future for all. By investing in HMPV testing, India is setting a global example in proactive healthcare. This initiative not only protects public health but also paves the way for future advancements in infectious disease control.